Scottish health bosses enjoy a luxury junket in Florida while NHS hospitals struggle. The Institute for Healthcare Improvement (IHE) conference was held at the four-star World Center Marriott Resort and Convention Center in Orlando, just outside Walt Disney World. It boasted a 4-day program of events including sunrise and sunset pilates, slap-up breakfast and lunch buffets, theme park trips and even a pool party with live music and a cash bar. Delegates at the Marriott had access to 10 restaurants, 6 outdoor swimming pools, a championship golf course, and full-service spa, while 5 nearby resort hotels were also fully booked. Speakers at the December 10 to 13 conference included the Scottish Government's strategic advisor Shaun Maher, Divisional Clinical Lead Craig White and Head of Improvement Program for Children and Young People, Susan Hanna. NHS attendees included Jonathan Kirk, National Clinical Lead of the Measurement and Monitoring of Safety Program at Healthcare Improvement Scotland, and Simon Edgar, Director of Medical Education at NHS National Services Scotland. Several other health service and government managers also jetted across the Atlantic for the conference, with photos on social media showing the Team Scotland huddle held each morning in the hotel lobby. While they were soaking up the sun, however, accident and emergency wards in Scotland recorded their worst waiting time performance in years due to freezing weather and a worsening flu outbreak. Only 86.9% of patients were seen within 4 hours in the week ending December 10, plunging to just 74.1% at Hare Myers Hospital in East Kilbride and 64.1% at the Royal Infirmary of Edinburgh. Scottish Conservative Shadow Health Secretary Miles Briggs said, "This is an extremely bad look for the SNP government." While casualty wards across the country went into meltdown, senior health bosses enjoyed the Orlando sunshine on taxpayers' time. Patients will feel it would have been better for them to do their work here while hospitals across Scotland were at breaking point. Boston-based IHE is a not-for-profit company with operating revenues of £37 million a year that has been handed an increasingly influential role behind the scenes within the Scottish Health Service. It has been NHS Scotland's quality improvement partner since 2013 at a cost to the taxpayer of £750,000 and is closely involved in the Scottish Patient Safety Programme, which works across hospitals, mental health, maternity and primary care. The U.S. firm is also part of the SNP's Early Years Collaborative to make Scotland the best place in the world to grow up in and works alongside councils, the police, social work and housing agencies. IHE's chief executive officer is Derek Feely, who stepped down as head of NHS Scotland in 2013, and many senior Scottish medics and managers are so-called IHE Fellows after undergoing mid-career training courses. As well as listening to inspirational talks and mingling with U.S. private healthcare firms, delegates could go on excursions to attractions such as Universal Studios, Central Florida Zoo or the Brad Brewer Golf Academy. There was also a free shuttle bus to Universal City Walk, the dining, shopping and nightlife mecca. Keynote speakers included General Stanley McChrystal, the U.S. military commander in Afghanistan, and Jen Lim, the chief happiness officer of her company Delivering Happiness. Conference fees began at £970 per person with several add-ons costing up to £500 each, although there was a discount for group bookings. The Scottish Government were asked for the total cost to the taxpayer but declined to provide specific figures. A spokeswoman said, "A very small number of Scottish Government officials attended this year's forum of the Institute for Healthcare Improvement. Our continued representation at this event is helping to improve healthcare and save lives in Scotland."